Welcome to The Gut Show. I'm your host, Erin Judge, registered dietitian and founder of Gemelli. I'm also your fellow IBS warrior. Our goal on this side of the internet is to empower those with IBS and digestive disorders to understand their gut better, to have a healthier relationship with their bodies, and to make confident choices to improve their digestive health. During this season, you can expect a conversation around a hot topic related to gut health, digestion, and IBS. As a disclaimer, I am a dietitian, but I am not your dietitian. So everything covered in this episode is meant to be educational and is purely information that you can take back to your healthcare team in order to make the best decisions for you. If you're new here and something just doesn't feel right in your gut, if your symptoms have led you to this podcast, I invite you to start by taking the quiz, What's Your Poop Personality? Your personality type will unveil what your symptoms may mean, what may be causing them, and what you can do about them. This is a free quiz and you can take it today at getovate.com or find the direct link below in the show notes. While you're going to take the quiz, let's jump into today's episode. Now for a quick word from our sponsors with resources that might support you. Is a gluten-free diet just not cutting it, or maybe not even necessary when it comes to chronic symptoms like bloating, gas, and pain? Research actually shows that in those without celiac disease, it's actually the FODMAP, the carbohydrate, fructan, in wheat, not gluten, that causes symptoms most often. This means that you may not need a strict gluten-free diet to see symptom relief. And it means that if you are reacting to fructans, there may be more foods in your diet beyond wheat that are causing you symptoms. This includes foods like garlic and onion, and even some fruits and vegetables that can sneak their way into your diet and contribute to those chronic symptoms. You can choose to limit these foods and reduce your overall fructan intake in order to avoid symptoms. You also have the option to break the fructan down using FODzyme, an enzyme blend that targets fructan, lactose, and GOS FODMAPs, and that will help you break these FODMAPs down to then prevent the symptoms. Learn more about FODzyme in the show notes, and you can use the code THEGUTSHOW for 20% off your first order. Did you know that you can now order your own gut health test without waiting months for a doctor's appointment? Gemelli Biotech offers trusted, science-backed, at-home tests for conditions like SIBO, EMO, ISO, and post-infectious IBS. Their Trio Smart Breath Test measures the 3 key gases, hydrogen, methane, and hydrogen sulfide, to detect different forms of microbial overgrowth. As for those with IBS symptoms, IBS-Smart is a simple blood test that can confirm post-infectious IBS with clinical accuracy. Validated by the leaders in gut health, these are tests that you can trust and tests that you can take comfortably from your home. So go to getgutanswers.com to find out which tests are right for you and use the code ErinJudge25, all one word, ErinJudge25, to save $25 on your order. And now let's get back to the show. So Dr. Bhopal is a board certified in psychiatry, sleep medicine, and integrative holistic medicine. She's the founder and medical director of Pacific Integrative Psychiatry, an online practice in California where patients receive a whole person approach to anxiety and sleep disorders, including sleep coaching and integrative and functional medicine. In addition to her private practice, Dr. Bhopal is the founder of IntraBalance, an educational platform for physicians and therapists that includes a YouTube channel and online courses on clinical sleep medicine for healthcare practitioners. Her passion is making clinical sleep medicine easy to understand and accessible to all. So some places you can connect with Dr. Bhopal if you are interested. But I'm so incredibly excited to have her come and speak today because as she's going to cover, sleep and digestion are so incredibly linked. And I feel like in the IBS space, sleep is not given enough credit for its role in symptoms, management, gut health, all the things. So Dr. Bhopal, thank you for being here and the floor is yours.
All right. Well, thank you so much, Erin. So I'm really excited to speak to all of you today about my favorite topic, which is sleep. So let's go ahead and jump in. So quick disclaimer, the information that I'm presenting is information only and is not medical advice. So as we get started, I'd like to invite you all just to join me in taking a deep breath in through your nose, hold, and exhale through the nose. And this is just a really great way to help you stay grounded, to activate your parasympathetic nervous system, which is the rest and digest part of the nervous system, which is really important for sleep and also for digestion and gut health. So that's just a really quick tool that you can use at any point during the day just to help you feel more centered. So I'm Dr. Nishi Bhopal. So I'm originally from Canada. I'm from Vancouver, BC. That's where I grew up, but I now live in the San Francisco Bay Area. Erin gave me a lovely introduction, so I won't go through all the details today, but my focus is really sleep medicine. I'm board certified in sleep. I'm board certified in psychiatry. So I love helping people with that intersection of sleep and mental health through an integrative holistic lens. So we use integrative medicine in my practice. And you may have seen me in some of these outlets where I'm a featured expert on sleep for a variety of different media outlets and platforms. All right, so we're going to start with Sleep 101. So we're going to review some sleep fundamentals. Then we're going to talk about the link between IBS and sleep. And there's actually a very close connection between the two. And as Erin was saying, it's something that's often overlooked in digestive health and IBS. So hopefully you'll come away with some insights from that section. And then we're going to go into some integrative strategies that you can use tonight, to help you get better sleep. So let's start with Sleep 101. So this is such an important topic because all of us have to sleep, right? So even if you yourself, if you don't have sleep issues, you probably know somebody who does. And the incredible thing about sleep is that it affects every system in the body. So it affects brain health, cognitive functioning, memory. You might notice that when you don't get a good night's sleep or you don't get enough sleep, it's harder to focus during the day. You might notice you're making typos or errors at work and things like this. And then longer term, it can have impacts on overall brain health. It's important for emotional health. So you might notice if you don't get good sleep, you might feel more cranky, more irritable, more depressed, more anxious. And we know that when people aren't getting good quality sleep, they're more likely to develop mental health conditions like anxiety and depression. It's important for heart health, cardiovascular health, for blood pressure. It's important for immune health as well, metabolic health. Hunger is also related to sleep. And then, of course, gut health, which we're going to be talking a bit about later as well. So science is still unveiling the mysteries of sleep. I kind of think of sleep medicine as like space travel. It's kind of the final frontier. There's a lot of mysteries and aspects of sleep that we still don't understand, but we do know that it is important and it affects every system in the body. So it might seem that sleep is a passive process, that you kind of fall asleep and now you're in the state of rest and then you wake up feeling refreshed, hopefully refreshed. If you're not, we'll talk about why that might be. But sleep is actually a very active process. There's lots of things that happen. So when you're sleeping, your brain is rolling up its sleeves and getting to work. So one of the things that it does is the brain actually comes in with its little broom and brush to sweep out toxins. So there's a cleanup, janitorial effect that happens during sleep. So these toxins are proteins that build up when we're awake. So when you're awake, your cells are undergoing metabolism, and then you build up different proteins, including things like amyloid beta, which is involved in Alzheimer's development later on. So during sleep, your brain actually washes out those proteins and those toxins that build up during the day. So that's a really important cleaning function. You also get consolidation of memories. Your brain is able to make connections during sleep. Your brain's able to create new neural pathways. So that increases your creativity. It helps you make better decisions. So if you've ever heard that term, I'm just going to sleep on it and make the decision tomorrow, that's where this comes from, because you have better mental clarity when you've gotten good sleep. So I kind of think of this as like stocking the shelves in the grocery store. So now like your brain's able to organize all the information, or even putting things in a file cabinet. So when you don't get enough sleep or good quality sleep, it's like your papers are all over your office, but during sleep, your brain's able to file those papers away. So now things are just more organized in your head. I mentioned cardiovascular health. So an important other function of sleep is this phenomenon called blood pressure dipping. So when we sleep, the blood pressure actually goes down. That's a normal function in sleep. So if you don't get enough sleep, or if there's something causing sleep disruption, your blood pressure doesn't have the opportunity to dip and go down. So what happens is then your blood pressure is now elevated all the time. So when I'm working with patients or clients who are struggling with high blood pressure, one of the things we really want to work on is getting them good restorative deep sleep so their blood pressure can actually dip during the night, which is also going to help it stay lower during the day. Another function is repair and growth of tissues, especially if you are exercising or if you're healing from a surgery or a procedure, or you've been sick and you need time to heal. Healing happens during sleep, especially during stage 3 deep sleep, which is also known as slow wave sleep. And then we also get increased activity in the immune system as well. And we know that the immune system is related to the gut. So this is just scratching the surface on what happens during sleep, but hopefully this gives you a good idea of how every body system is affected by sleep. So I'd love to hear from all of you in the chat. How much sleep do you need to feel rested? And it's different for everybody. Would anybody like to share in the chat? I see 8 hours, 10 hours, 8 to 9 hours, lots of 8, some 6 hours, 7 to 8, 9. Yeah, so kind of all over the board, right? So everyone's different. I see someone 4 to 5 hours. Yeah, but it looks like it's averaging around 7, 8 hours, a little bit more. Never enough from Hillary. Yes, yeah, I'm with you, Hillary, on that. So so most adults need 7 to 9 hours of sleep to be rested. How many people are actually getting that? Let me know in the chat if you're actually getting the amount of sleep that you need. Most of us are not. And sleep deprivation is actually a public health epidemic. The CDC has declared that insufficient sleep is a public health crisis. Yeah, and I see lots of no's, some usually, that's great, not getting enough. So super common that most of us are not getting enough sleep for our needs. And again, there's a lot of variability. So some people are considered long sleepers, so that might be closer to that 9 or 10-hour mark. Some people are considered short sleepers, so you might feel rested with about 6 hours. But why I'm emphasizing this is that it's important to know what your needs are and not to compare it to somebody else's. Because if you use a tracker like an Oura Ring or, Fitbit or anything else, you might fall into that trap of comparing it to your spouse's sleep or, to your friend. But we're all so unique. Our physiology is unique that it's really important that you're tuned into what your unique needs are. And we're going to talk about some ways to optimize the sleep that you are getting so that it is more restful and restorative. And that last comment I have here is that naps can be good. So you may have heard that it's not a good idea to take naps, which is true for people experiencing insomnia, which is kind of a separate thing that we'll touch on a little bit. But if you do feel like in the middle of the day, around 2 or 3 p.m., when you're almost craving that caffeine hit, taking a short little restorative rest, you might not fall asleep, but like a rest for about 10 or 15 minutes is actually shown by research to be very restorative. And it can help you with your energy levels. It can help reduce the fatigue that you might feel later in the day. And in fact, some companies like Google, NASA, Huffington Post, Ben and Jerry's, all different companies, they have nap rooms in their offices, not because out of the goodness of their heart, they want people to be rested, but because they know it's really good for brain health and cognitive functioning and productivity to take a rest during the day. So sleep and rest is not just about what happens at night, but how you go through your day as well. So how you start your morning, how you go through the day, and what you do in the evening affects how rested and how well slept you are at night. So I want to introduce you to what I call the 4 sleep pillars. When you're working on your sleep, it can feel a little bit intangible sometimes or a little bit nebulous. Where do I start? There's lots of information on social media about different things like magnesium supplements and blue blocking glasses and all kinds of things. And it can get a little bit overwhelming to make sense of it all. So what I recommend is going back to these 4 pillars and kind of assessing yourself in these 4 different areas. So the first one I have on the left is the circadian rhythm. So that's your body clock. We're going to talk about how to regulate that. The next one is your sleep drive. This is how sleepy you feel at night. So you can think about sleep drive like hunger. So the longer you go without eating, the more hungry you are. So the more active and the longer you go without resting, the sleepier you are. So it's like your hunger for sleep, and there's ways to modulate that. On the bottom left corner, I've got the mind and nervous system. So even if you've got your body clock totally tuned up, you're active during the day, maybe you have a little bit of that rest in the afternoon, but you're pretty active. If your nervous system is in a state of hyperarousal, that could be from medical issues, or if you're experiencing a lot of stress, a lot of anxiety, that's going to override those other systems. So you want to make sure you're working on that nervous system regulation piece. And then the 4th piece I have there is the nutrition and gut health, which we're going to get into as well. Because if you're not digesting food properly, if you're not getting enough nutrients, your body isn't able to synthesize the neurotransmitters and the hormones involved in sleep, like serotonin and melatonin, acetylcholine, and all of those kinds of things. So we'll talk a little bit more about gut health in a few minutes. So let's talk about IBS and sleep and the relationship. And I just wanted to look at the comments here. I see in South America, closed down for 3 hours in the afternoon. So all businesses and stores closed for 3 hours in the afternoon. Yeah. So in many countries, there's the siesta period in the afternoon. So I think that's important to recognize because there is no one size fits all way to sleep and way to go through your day. Okay, so when it comes to IBS and sleep, there is a bidirectional relationship. So what that means is that sleep issues can increase a person's risk of developing IBS, and then IBS symptoms can increase the risk of having sleep issues. So the relationship goes both ways, and it can become a vicious cycle for some people where now you're trying to get a handle on both and you feel like it's all out of control. What is the connection actually? So research shows that people with IBS are significantly more likely to have sleep disorders. And when I'm referring to sleep disorders, it's not just insomnia. A lot of times we're thinking about insomnia, which is trouble falling asleep or trouble staying asleep, or maybe waking up too early and having difficulty getting back to sleep. That's one type of sleep disorder, but people with IBS also have a higher risk of hypersomnia, which is excessive daytime sleepiness during the day. So feeling really fatigued, really sleepy, really tired, like you just don't have enough energy. So both of these are 2 to 4 times more common in people with IBS. And there was a large study that was done in the US. You can see there's a reference down there at the bottom. And what they did find was that for people with IBS, these sleep issues were more common, even if they did not have another diagnosis of anxiety or depression or stress, even, because a lot of times people think of sleep issues as being related to stress. But this study indicates that IBS alone can increase those sleep issues, even if there aren't those other mental health symptoms going on. So there is a strong connection between the gut and the sleep system. So is sleep causing IBS or is it the other way around? This study was pretty interesting, and the link is there at the bottom as well if anyone wants to take a deeper dive into the research. So this was a genetic study, and what they found was that for people who have a genetic tendency towards insomnia, that also puts them, that same genetic variant also puts them at risk of developing IBS. So that's pretty interesting. So poor sleep might not just make IBS worse, it actually might cause IBS or be one of the causes of IBS in some people. So the same study suggested that improving sleep, treating insomnia will not only help a person's sleep issues, but it also can help alleviate some of the symptoms of IBS. So sleep isn't just a symptom to be managed or something to think about with IBS. It actually is a root cause factor that needs to be taken seriously and addressed. So why this matters for you is that, again, sleep issues are not just side effects of anxiety or depression or stress or IBS symptoms. They might be driving IBS and gut health issues. So there was another study that was done in Australia, and they found similar findings where even if people didn't have psychological stress, they still had sleep problems linked to IBS. So again, just also highlighting that the sleep issues aren't necessarily related to stress and anxiety. And sleep also affects your circadian rhythm, like we were looking at, but that impacts your gut motility, your digestion, your hormones, your hunger hormones, blood sugar regulation, and so many things. So there is that direct connection. So working on sleep can help reduce IBS flares. It also can lead to better mood, better energy, and then overall improved quality of life. Just think about how you feel when you've slept well, right? I feel like I have superpowers sometimes when I've gotten a really good night of sleep. I have more energy to exercise. I want to spend time outside. My mood is better. I feel like I can focus. So imagine if you're getting good sleep on a regular basis, how that's going to affect your quality of life. So if you have IBS and you're struggling with sleep, talk to your healthcare team because sleep should be part of your treatment plan. Okay, so let's move into some strategies to improve your sleep. And I like to look at things through an integrative lens. So what that means is looking at all of the different factors that can influence sleep from alternative medicine as well, looking at botanicals, supplements, mind-body practices, and so on. So I'm going to highlight a few of them. There's so many different, like we could do a whole webinar series just on each of these different elements. So I'm going to touch on a few of these at a high level, just to give you an introduction to what's out there. So some of the integrative strategies include botanicals, supplements, Chinese medicine, Ayurveda, which is the traditional system of healing from India, functional medicine, hypnosis, which is also helpful for IBS, guided imagery, manual therapies like massage, healing touch, breathwork, sound healing, so many things. So let's go back to our sleep pillars, just so we can have an organized way to go through these. So as a reminder, our pillars are the circadian rhythm. So it's regulating your body clock, your sleep drive, or you can think about that like your sleep hunger, your hunger to sleep at night, your mind and nervous system regulation, and then nutrition and gut health. Starting with the circadian rhythm. Okay, so a lot of us think about circadian rhythm in terms of sleep, and yes, it does influence sleep-wake cycles, but it also influences everything else. So your circadian rhythm is like a clock in your brain that tells your body when to do things, when to secrete thyroid hormone, when to secrete insulin, when to secrete, your female hormones. All those kinds of things are impacted by your circadian rhythm, and then melatonin and cortisol are impacted by it as well. So the more you can keep your body on a clock, the better all of those systems work. So it's like the schedule for your body. Now, I know that's challenging for people who are working shifts, or if you have a job that requires you to get up at different times, but you want to focus as much on keeping regularity as possible with certain behaviors that we're going to look at. So this is about progress over perfection, right? So we're not striving to be perfect because that creates more nervous system dysregulation and stress, but having some self-compassion around this, doing it with the spirit of nourishing your body, is a great way to go into this. So the three things that affect your circadian rhythm are the timing of light exposure, the timing of meals, and the timing of your physical activity. If you can focus on those three things, that is going to tell your body what time it is, and it's going to keep your clock synchronized. So how we do this is you want to get up out of bed around the same time every day. And when I say around the same time, I'm talking about 30 minutes of the same time every day. So I have some patients that I work with where they might get a bit anxious that, well, yesterday I got up at 7:02 a.m. and today I got up at 7:05 a.m. Is that okay? Is that going to throw me off? So a few minutes is okay. Once you go beyond 30 minutes, like if you're getting up about an hour's difference from day to day, it's almost like you're traveling across a time zone. So it can create a jet lag effect. So it's like you're going from California to Arizona. Even though it's only an hour, it can still have an impact, right? We just changed the clocks. If you're living in a place where you change the clocks in the springtime, you see how much that has an impact. So trying to get up around the same time every day, getting bright light in the morning, that's one of the strongest cues for your body clock. And I call this the 10 before 10. So 10 minutes of bright light before 10 a.m. is really impactful for synchronizing the body clock. And if you do that every day, just for a few weeks, just pay attention to how that impacts your sleep and your energy. Another one that I really emphasize is to try to eat your meals around the same time each day, again, within that 30-minute window. And when you're struggling with gut issues, sometimes you just might not feel like eating. You might feel nauseous, or you just don't have an appetite, or you're bloated and you don't want to eat. So what I do recommend in that case is to at least keep an anchor midday. So if you can have your lunch around the same time every day, and have something that you can tolerate, even if it's just some broth or something light, but make sure you're having something around the same time each day. And that creates an anchor for your circadian rhythm, and it keeps things running on time. And when I do this with patients, what they tell me is that, oh, now I actually do start to feel hungry. And I feel like my digestive system is even working a little bit better now with that regularity. Now, I have a note here about melatonin at the bottom. So melatonin is a hormone that's produced by your brain. It's produced by the pineal gland in the evening to help with sleep onset. Often, again, we think about melatonin in terms of sleep. But melatonin is actually a really fascinating hormone. It has anti-inflammatory effects, antioxidant effects. It's being researched for different conditions like sepsis, like in the ICU. It's being studied for its use in cancer because of its antioxidant effects, and also in gut health, inflammatory bowel disease. And there's research showing that in IBS, melatonin may actually improve IBS symptoms. And I'm not even just talking about sleep, but IBS symptoms like abdominal pain, inflammation, and quality of life, even for people who don't have sleep issues. And in this research, they're using doses of around 3 milligrams up to 6 milligrams. I have the reference there for anyone who wants to look at that. I think that's just a really fascinating area of research that's coming out. And then melatonin does help with sleep and the body clock as well. So that's another consideration. So pillar 2 was our sleep drive. So remember, this is your hunger to sleep at night. So how do we increase that? Well, one thing that I recommend to everybody is don't spend time in bed when you're not sleepy. What happens is if you're spending time in bed when you're not sleepy, that actually trains your brain to associate the bed with being awake. So now it becomes a conditioned response where you get into bed and now you're wide awake. Like, do you ever fall asleep on the couch and then you get into bed and now you're like, why am I wide awake now? I was just sleeping so soundly on the couch, because there's now an association that the couch is relaxation and the bed is associated sometimes with a bit of frustration or wakefulness. So we want to break that association by not being in bed during the day. And I see this a lot with my young adults. They're hanging out in bed, they're reading in bed, they're on their computer, they're on their phone in bed, or, that's their relaxation place. But the brain has now made an association of being in bed and being awake. So that's just a tip. To regulate the mindset and nervous system, you want to really examine, well, what is my relationship with sleep? And when I'm working with people who are struggling with chronic insomnia, they almost develop a phobia of being awake at night. So now they're dreading bedtime. They're awake at night and they go into a panic state because there's a lot of fear and anxiety about not being able to sleep. So that's a core component to work on. If that resonates with you, then I want you to think about what your relationship with sleep is. Is it something that is a source of stress and frustration? Is it causing anxiety? Are you finding yourself Googling how to sleep better? Are you trying lots of different supplements or medications to try and sleep? That can actually feed into that fear and that anxiety. So an important thing to know is that you don't want to try to sleep. The harder you try to sleep, the worse it gets, the more elusive it becomes. So think about, if you're surfing. I'm in California, so, we go to the beach and I don't surf myself, but I love to watch the surfers, and they can only surf when there's a wave, right? So if you're out there and you're trying to surf when there's no waves, it's not going to work very well. So trying to sleep when you're not able to is kind of like trying to surf when there's no waves. So it just makes it more frustrating and you're not going to go anywhere. So instead, what you want to do is shift your focus to relaxation. And a key point here is not to relax with the intention that it's going to help you sleep, because there's still that association, that frustration can come in, but just focus on enjoying the moment and relaxing. And I know this is way easier said than done, but the principle is important to understand. And if it's something you're struggling with, then there are specialists who can help you with this. Now, other things that could dysregulate the nervous system are also medical issues. We're going to talk a little bit about that briefly as well. Now, for people who are struggling with chronic insomnia and some of the things I was just talking about, the first line gold standard treatment is called CBTI, which is cognitive behavioral therapy for insomnia. And it is more effective than medications. It's more durable than medications. What that means is that the results last longer over time. With sleeping pills, you have to stay on the sleeping pill for it to work. But with CBTI, you can learn the principles and then experience the improvements long term. Interestingly, there are studies now showing that CBTI reduces IBS symptoms as well, including abdominal pain and discomfort. So even though the treatment is focused on sleep, it has far-reaching effects and improvements on other symptoms also. So the American Gastroenterological Association recognizes that CBTI can help manage IBS by addressing some of those other psychological factors that contribute to gut health symptoms. So CBTI isn't just for insomnia, it's kind of like a 2-for-1 solution that it can address both sleep and IBS. There's also another type of therapy called mindfulness-based therapy. So MBCR is mindfulness-based cancer reduction, but that is specifically for people who have cancer or are in recovery from it, but there's lots of studies on that, so that's why I mentioned it there. What they have found is similar levels of reduction in insomnia compared to CBTI, which I was just talking about. So people who go through the mindfulness training do see those sustained improvements as well. And for some folks, that mindfulness approach can be more effective than the CBTI approach. So I just wanted to highlight that because, again, everyone is different. And so I have patients who really resonate with the CBTI, and I have others who it's not for them, but they prefer the mindfulness. So it's important to kind of know what resonates with you, because the therapy that's going to work is the one that you're willing to engage in and that you feel like is a good fit for you. So yoga is another therapy as well that has been shown to help with sleep. So yoga is a large umbrella. It includes lots of different types of practices like physical postures, meditation practices, breathing practices. So, you don't have to be really flexible to do yoga. Anybody can do it. It doesn't involve twisting into pretzel-like postures or anything like this. It's for all age groups and all types of people. And it is shown to improve sleep in people with and without medical conditions. There was a study in older adults where they found that a 12-week yoga class helped to improve sleep and quality of life in older folks with insomnia. There was another study looking at menopausal women, and again, a 12-week program was shown to reduce insomnia. It also helped to reduce their other vasomotor symptoms like hot flashes as well, which was really interesting. And then there was a study in cancer survivors who were taking medications for sleep, and they had moderate to severe sleep issues. And in this program, they had a 4-week yoga class in addition to a home practice. And they found that not only did this practice improve their sleep quality, it also reduced their reliance on sleeping pills, which is pretty remarkable for that population. So again, if this is something that resonates with you, then looking into this can be really helpful for reducing that hyperarousal response, the stress response, and improving sleep.
Now for a quick word from our sponsors with resources that might support you. Are you struggling with bloating, constipation, or diarrhea, and you're still waiting to see your doctor?
Take control and get answers with Gemelli Biotech's at-home gut health tests.
The Trio Smart Breath Test is the only at-home test that is validated to look for all 3 gases that are associated with microbial overgrowth: hydrogen, methane, and hydrogen sulfide. That means it can detect SIBO, EMO, and ISO in one simple test. It ships right to your door, no appointment needed. You take it and you send it back, then you get answers. If your IBS symptoms started after a stomach bug or food poisoning, it could be post-infectious IBS. The IBS-Smart blood test is a quick at-home test to help identify it. Fun fact, 1 in 9 people who get food poisoning will end up with post-infectious IBS, and most don't even know they have it.
With both of Gemelli Biotech's tests,
you'll get clinically backed results in about a week, and you can take them straight to your provider. No waiting, no referrals, just answers. Find out which tests are right for you at getgutanswers.com and use the code AaronJudge25, all one word, AaronJudge25, to save $25 on your order. You can also find all these details in your show notes. As someone with IBS-C, I've struggled with symptoms related to food for the majority of my life, specifically FODMAPs. My personal triggers, beans, dairy products, garlic, and onion, would leave me feeling bloated and uncomfortable after meals, especially whenever I was eating out or traveling or living my life outside of my home, which meant I either had to just deal with the symptoms or eat bland, awful food and miss out on experiencing the social interactions and the joy of food. Finding FODzyme was a game changer for me. This is an enzyme blend that targets FODMAPs, specifically the GOS that's found in beans, fructan in the garlic, onion, wheat, and even different fruits and vegetables, as well as lactose in dairy products. I stash this in my wallet, my husband's wallet, every bag I own. I take it with me everywhere I go so that I can simply sprinkle it on my meals, eat with confidence, and feel my best after. If you want to try FODzyme for yourself, go to fodzyme.com and don't forget to use the code THEGUTSHOW, all one word, THEGUTSHOW, for 20% off your first order. And now let's get back to the show.
Aromatherapy is another integrative modality that is evidence-based and can help with sleep. There's still a lot of research that needs to be done, but we do know that lavender essential oils and jasmine essential oils, and there's some others as well, can help with sleep. And it's not that these are sedatives necessarily, but they help by reducing the stress response and the hyperarousal. So they activate the parasympathetic rest and digest nervous system. And in doing so, then they help with sleep. So lavender has the most studies behind it. It's shown to promote slow wave sleep as well. It reduces nighttime awakenings, and it's shown to reduce anxiety. So if you are exploring aromatherapy, a few things to consider are making sure that it is a pure essential oil, not an artificial scent, because the essential oils contain compounds that have those therapeutic effects. You want to make sure that it's being stored properly in an amber bottle, storing it away from heat and light, that you're using a good quality product. If you're using it in a diffuser, you want to make sure you have good ventilation in your room as well. And just a quick note about lavender is that it does have mild estrogenic effects, so it can increase estrogen. So if you have a hormone-sensitive cancer or some other hormonal types of issues, then you want to talk to your doctor first to make sure it is safe for you, because it can have some side effects in patients with those issues. So let's talk about pillar 4. I'm just keeping an eye on the time. So let's look at nutrition. So we're going to talk about food, some dietary supplements and botanicals, and then a bit more about gut health. So food has an impact on sleep quality. And then sleep also has an impact on the type of food that we crave. So you might notice when you're sleep deprived, or if you haven't gotten a good night's sleep, you're not craving an apple in the afternoon. Usually we're craving that bag of chips or a cookie or something like this, right? Those high carbohydrate foods. But the type of food that we eat also can impact sleep quality. Again, this is an emerging area of research, but it is shown that people who eat foods that are higher in sugar and refined carbohydrates actually take longer to fall asleep and wake up more during the night. Sugar also increases excessive daytime sleepiness, so feeling sleepy, tired, fatigued. On the flip side, it's shown that diets that are higher in fiber improve sleep quality. You actually see more deep, slow wave sleep related to increased fiber intake, and it reduces daytime fatigue. So the Mediterranean diet is associated with better sleep quality. And the Mediterranean diet, as most of you probably know, is mostly fresh, unprocessed foods, lots of plants, and healthy fats. When you eat also has an impact. So we talked about having that midday anchor to keep your circadian rhythm synchronized. You want to avoid a heavy meal within 3 hours of going to bed, because that can increase reflux. It can have a negative impact on your sleep quality. But if you do tend to wake up in the middle of the night, sometimes that could be from a bit of a cortisol surge or a drop in blood sugar. So if that is an issue for you, then it can be helpful to have a high fiber or high protein snack about an hour before you go to bed. So I have some examples here, like fruit with nut butter, veggies with hummus, or berries with whipped cottage cheese, those kinds of things, just to stabilize your blood sugar. Now, it is normal to wake up in the middle of the night. I just wanted to make that clear, that that's part of our sleep architecture, to have these awakenings throughout the night. But if they're prolonged, or if you're waking up feeling kind of panicky, anxious, or it's really hard to get back to sleep, sometimes that could indicate a blood sugar dysregulation issue. Now, in terms of dietary supplements, I mentioned earlier that we need micronutrients to support synthesis of our neurotransmitters, like serotonin, like dopamine, like melatonin. So some of these micronutrients include things like vitamin D. So when I'm working with patients in my practice, we do check vitamin D levels, and we're looking for not just a normal level, but an optimal level, which is, at least in the US, it's around 50 or 60. Depending on the units that you're using to measure it. Magnesium is a pretty critical nutrient when it comes to lots of different functions in the body. It's involved in over 300 different enzymatic reactions. And you've probably seen a lot of information about magnesium on social media when it comes to sleep. It is not a sleep aid. And, I get this question a lot from people about what's the best magnesium for sleep and things like this. So the research on magnesium for sleep is actually pretty limited. There isn't a ton of research showing that magnesium is helpful for sleep specifically, but we do know that when people aren't getting enough magnesium, whether it's because of lack of intake, which most of us are deficient in magnesium because of micronutrient depletion in the soil, or if you're having digestive issues, that can have a negative impact on sleep. So it's a pretty critical nutrient that I do recommend it to most people. Iron is also an important one, especially for women who are menstruating, but even postmenopausal, iron is really important to keep an eye on. Low iron levels are associated with restless leg syndrome and even restless sleep. So we're looking for a ferritin level. So ferritin is Ferritin. That is a marker of iron levels in the central nervous system. So we're looking for a level of around 100, which is way beyond the normal range. The normal range usually starts at 20. So we're looking to get to that 75 or 100 level mark. We don't have time to go into detail on that today, but I just wanted to highlight that because that's a thing that's often missed. B vitamins also are important for circadian regulation, for sleep quality, for energy levels as well. So I'm talking about things like vitamin B12, folate, and things like this. And then a quick note about botanicals. So you've probably seen lots of different supplements out there that have ashwagandha or valerian or chamomile, hops, things like this. Sleepy Time tea contains some of those things. Or if you go to your local drugstore, you'll see these different botanical blends. So traditionally in traditional healing systems like Ayurveda or traditional Chinese medicine, usually botanicals are used in combination because they support each other in different ways. What I tell people is that just because something is natural, it doesn't mean that it's safe. So some of these botanicals do have drug interactions or shouldn't be used if you have certain conditions, like for example, ashwagandha. For people with thyroid conditions, you have to use it with caution. So if you have access to somebody who understands botanicals, you know, a healthcare practitioner or someone who has training in Chinese medicine and things like this, then it's a good idea to talk to them if you are on medications or if you have other medical issues, because these botanicals can be quite powerful. So when it comes to sleep, there actually is some evidence for them. The three plants that have shown the most potential based on this study from 2021 are valerian, passionflower, and ashwagandha. There's also other studies showing that a combination of valerian, hops, and passionflower had the best results in clinical trials. So I know we just went through a lot of information and it might feel a little bit overwhelming, like, oh my gosh, there's all these different things. So go back to the basics. Think about what makes sense for you. Where would you want to start? Do you need to work on tuning up your circadian rhythm and getting that stabilized so you're on a more regular schedule with your meal times and your light exposure? Do you need to work on sleep drive, maybe spending less time in bed, being a little bit more active during the day to build up that sleep hunger? Or maybe you need to focus on the mind and the nervous system regulation piece. Or maybe there's room to improve nutrition, gut health, maybe looking at some of those micronutrients. So I encourage you to just take some time after this talk today to reflect on, okay, where might I want to start? So there is no one size fits all approach. You want to tune into your own needs. I know some of you are struggling with insomnia. I saw some comments about hypersomnia. So you have to figure out, okay, what makes sense for me? We didn't even talk about sleep apnea. We talked a bit about restless leg syndrome. So there's all these other sleep disorders that could be at play as well. But sleep issues are highly treatable. I see some questions coming in, so we'll wrap up and then we'll do some questions. So we talked about Sleep 101. We looked at the link between IBS and sleep, and then we looked at some integrative strategies for better sleep. So thank you for your attention. If you'd like to learn more about some of these topics, I do have a YouTube channel where I go into a bit more detail. And feel free to connect with me on LinkedIn as well.
Thank you so much. Do you want to jump into the questions or do you want me to feed to you?
Yeah, I can jump in. Yeah, if that's okay. Yeah, so I'm just going to pull up the chat here. Let me just scroll through because I know somebody had asked about CBTI, like where do you find a CBTI doctor? So I'm just, oh yes, what kind of doctor does CBTI? So you can do CBTI with a behavioral sleep psychologist. Some sleep doctors like myself also offer CBTI. And there's also people who are sleep coaches they're like a health coach, but they're sleep coaches and they're also trained in CBTI. If you are looking for somebody who does CBTI, I've got information on my YouTube channel. You can also go to the Society of Behavioral Sleep Medicine website, and they have a directory where you can search by country, and then you can narrow it down by your city to find practitioners in your area. So Society of Behavioral Sleep Medicine. Does time of day of yoga have a greater effect? Oh yeah, that's a great question. So yes and no. So you can do yoga during the day, and that's actually a great way to start your morning, to get your nervous system regulated as you go into your day. You can do it midday or after work as well. And then having a little bit of a wind down routine at the end of the day, if you want to build yoga into that, that can have an impact. But it really doesn't matter. It's not that it's necessarily going to be more effective if you do it in the morning or if you do it at night, because it's really about keeping your nervous system regulated on an ongoing basis rather than, having a spike of stress during the day and then using the yoga at night to calm it down. So it's kind of an overall balance when you're doing a daily practice. So hopefully that made sense. Yes, and I see a comment, diagnosed with multiple chemical sensitivity, essential oils. Yeah, exactly. So essential oils are not for everybody. And again, there's all these different tools that I shared that you can use to figure out what makes the most sense for you. Okay, I got diarrhea with magnesium pills. Is cream okay? Yeah, so you can try the cream, see if it helps. There is limited data showing that you can absorb magnesium through the skin. Personally, I do find that Epsom salt baths are helpful because you get magnesium sulfate. But again, like how much are you absorbing through the skin? It's really not known. And so far, the research shows that you don't actually absorb a lot through the skin. So for the magnesium pills, if you're unable to tolerate them, you want to think about the form that you're using. So magnesium citrate usually causes more diarrhea. Generally, magnesium oxide is a little bit more tolerated, or magnesium glycinate can be more tolerable for the GI tract. So I don't know, Joanne, if you've tried different types of magnesium pills, but the form does matter. Question about, is it okay to start as high as 3 milligrams for melatonin or 3 micrograms? Yeah, great question, Judy. So when I'm using melatonin for sleep issues, I'm usually using 0.3 to 0.5 milligrams. But the research for IBS specifically was looking at 3 to 6 milligrams, so quite a bit higher than that. And the reason they're using those higher doses is for the anti-inflammatory effects. So those were the doses that were shown to reduce the IBS symptoms. So the abdominal pain, discomfort, and bloating. So it's a little bit of a different indication. But generally for sleep support, if I'm using melatonin with someone, I'm usually using 0.3, 0.5, or up to 1 milligram. I usually don't go beyond that unless there's a specific reason to, if there's some other medical issue that we're targeting. Question about Dong Quai. Yeah, to be honest, I don't know much about that. I'm not trained in Chinese medicine. So yeah, sorry, I'm not able to help you with that question. A little outside of my scope of knowledge. Be careful with iron, following with doctor because you can get toxic. Yeah, so iron is one of those things you can get too much. So it is a good idea to have those levels checked. I don't recommend just taking it without guidance. So when we're using it with my patients in our practice, we are checking levels. We're checking their CBC, iron, and ferritin levels on a regular basis to make sure that their levels stay within the range that we want. Okay, and then it seems like drinking any warm beverage, even herbal after dinner, gives me nasal congestion and interferes with sleep. And then what do you think of mouth taping? Mouth taping, yeah, it's a really good question. It's a little bit controversial because for people who have sleep apnea, or if they've got a lot of nasal obstruction or nasal congestion, mouth taping is probably not a good idea. You want to make sure that you are nasal breathing during the day. And so really working on that and then getting evaluated for sleep apnea or sleep breathing issues if there's any symptoms of snoring, of difficulty with mouth breathing, or like, if you're mouth breathing at night, waking up gasping. But in women, waking up frequently throughout the night, getting up to urinate a lot throughout the night, those can also be symptoms of sleep apnea. Even feeling a lot of daytime fatigue, chronic pain issues, even like fibromyalgia type symptoms could be a sign of sleep apnea in women. So before going to mouth taping, for people who are experiencing those types of symptoms, it's a good idea to get that evaluated. There is a role for mouth taping for some folks, but I usually don't recommend it to people because I'm trying to figure out what's going on actually and why are they not able to breathe, or why are they mouth breathing at night? What about aromas affecting our pets? Yeah, that's a really good question. Yeah, Amy, I'm not sure actually. To have to look on the research to see if there's any data on that. Great question. How does falling asleep to TV affect sleep even with a timer? Yes, okay. I love this question because I get asked this like almost every day by my patients. And so there is this idea out there that screens are horrible for sleep and you should never watch TV and fall asleep and things like this. Now there's emerging research showing that actually might not be the case. So for people who struggle with a lot of ruminating, like if you're thinking a lot at night, if your mind is really active, it actually can be helpful to have something on in the background, whether it's a TV show that you've seen before or a podcast or something like this that kind of distracts your mind a little bit. that can actually be helpful for some people if you're falling asleep to that, even with the timer. I don't recommend just having the screen on the whole time because that can start to disrupt your sleep at night. So for some of my patients who do find that it's helpful to have something on in the background, what I would advise is you can play something that you've seen before so that you're not listening to hear what's going to happen. Put your screen face down if you're watching it on your phone or your iPad, so you're not getting that light stimulation, and then do have the timer on. So it's not an absolute no-no. For some people, it actually can be helpful to use that strategy. Research on lavender, yeah, I can send that to Erin. Can I send that to you, some of the research studies? And yeah, and then she can share that. Melatonin every night, is it okay long term? So it depends. For most of my folks, if I'm using melatonin with them, I'm usually just using it for 4 to 12 weeks as a reset, as a support. For some patients, I do have them stay on it long term if they're on a medication that can inhibit melatonin production. So those are things like beta blockers can suppress melatonin production. Fluoxetine or Prozac can also suppress melatonin production. So I might use melatonin every night as almost like a repletion strategy in those patients. So most of the time I'm not using it long-term just because there's limited data on what happens with long-term use. However, like I mentioned, there's other uses for it. Like, for IBS, we're using it for its anti-inflammatory effects. It's being used in cancer and things like this at different dosing strategies. So that would be different in those types of people. But for sleep, usually shorter term. And in many countries outside of the US, melatonin is available by prescription only. It's considered a pharmaceutical and a hormone. And so it has to be monitored every 6 months by a licensed healthcare provider in order to continue. Just because, again, there's not a lot of research on what happens taking it long term. And I'm just looking to see if there's anything else. Since melatonin is naturally produced in the dark, I take it as a supplement, shutting off lights right after taking it will make it the most effective. Yes, great, Katie. Yeah. So melatonin is produced by the brain in response to darkness in the evening. So the best thing you can do to enhance your own natural melatonin production is to get that bright light during the day by going outside ideally, but if you're not able to go outside, then a light therapy device is the next best thing, and then turning off the lights in the evening. So creating a cave-like atmosphere in your home, dimming the lights after about 7 p.m., even switching to orange or yellow bulbs or red bulbs in your lights can be really helpful. I try to avoid the overhead ceiling lights and just use table lamps and dim lights and things like this, and that can help promote your melatonin production. I feel like my amount of sleep varies from one night to another. Is that usual? Is it good or not good? Yes, so that's totally normal. Sleep does vary from night to night, and that's okay. As long as on average you're getting your baseline sleep needs, whether that's 7 hours or 8 hours, whatever that is for you, it should average out to about that. So I don't mean some nights you should get 3 hours and some nights you should get 12, not like that, but if it's fluctuating by an hour here and there, that's actually normal for most people. Yes, and I see your comment about going outside is light source can be tricky. Absolutely. So then you can use a light therapy device, which are also helpful for seasonal affective disorder in the wintertime. Even here in the Bay Area, it gets really foggy sometimes, and so light therapy device can be really useful. Does mouth breathing during the day interfere with sleep at night? Yeah, so that's a really great question too. So mouth breathing, in short, mouth breathing it tells your body that you're in a state of stress. So it activates the sympathetic nervous system, which is the fight and flight response. So if your body's in that state of stress, that's going to have a negative impact on your sleep at night because you're going to have elevated cortisol, elevated stress hormones, which is negatively impacting sleep at night. So for anyone who's struggling with mouth breathe, like if you're not able to breathe through your nose during the day, then it's worth exploring why that might be. Are there nasal polyps, nasal obstruction, allergies? Are there things you can do to treat it? There is an app called Snore Gym, and it's a myofunctional therapy app that actually trains your airway to breathe better. So that's also another resource for people to try if you want to work on your airway and your breathing. And then does iPhone use before bed impact sleep, games, etc.? Yeah, so it depends. If the games are quite interactive, then it can activate your nervous system, it can get you engaged, and it can cause some sleep displacement where like now you're going to bed later because you're engaged in this sort of game. or activity. So I recommend if you are going to do something like Wordle or whatnot, like you can only do it once, right? Like then it's done. You have to wait till tomorrow to do the rest of it. It's not going to keep you going because a lot of other games have this built-in function called dynamic gameplay. So what they do is the more you play it, the more it adapts to your level because they don't want you to turn it off. They want you to keep on going. So just be mindful of what type of game it is. Should melatonin help right away or does it take a while to build up to help with sleep? So the way that I think about melatonin is that it's more of a body clock regulator than a sleep aid. So when I'm using it with patients and clients, we're using it to regulate their circadian rhythm. It's less so as a sedative. Sometimes those higher doses, like the 3, 5, 10, even up to 20 milligrams, can have that bit of sedating effect. But generally, we're using it to stabilize the circadian rhythm, and that can take some days or even a couple weeks to really regulate the sleep-wake cycle. I was using Tylenol PM, was told is not recommended for older patients. Yeah. So Tylenol PM is diphenhydramine based. It's basically Benadryl. And that has lots of anticholinergic effects. So, and it's obviously an antihistamine too. So that's not good for memory, for cognition. So yeah, definitely not recommended for daily use and not good for older folks. What's the ideal amount of deep sleep per night? So sleep follows a specific architecture. There's different stages that we go through during the night. So the stages are stage 1, which is the transitional stage where you're going from wakefulness to sleep. That's about 5% of sleep. Stage 2 is still considered light sleep. That's a little bit deeper. That's about 50% of total sleep. Deep sleep is stage 3. It's about 20% of total sleep for an adult. And then REM sleep, rapid eye movement sleep, is about 25% of total sleep. If you're using a tracker, so if you're using an Oura Ring, Apple Watch, or something else, take that data with a grain of salt because the trackers really aren't that accurate at measuring sleep stages because sleep stages is based on EEG brainwaves. That's how you know what stage of sleep you're in. That's what we do in the sleep lab. So these aren't measuring brainwaves. They're kind of inferring that data from respiration, from heart rate variability and things like this. So they're really not that accurate because people will come to me saying like, oh my God, my REM sleep last night was only 12%. So I tell them it's okay. Don't worry about that because it's really not that accurate. Okay. And I'm just keeping an eye on the time. Erin, should we stop here or keep going?
There's been a couple quick questions I can filter. Someone asked about hormone replacement therapy. If you're on that already, does melatonin impact that at all since it's also a hormone?
Oh, that's a really good question. So I think it would depend on what type of hormone that you're on. However, so I would presume if you're using hormone therapy, it's probably for perimenopause, menopause. There is data showing that melatonin in that population can actually be helpful. But that would be a question to talk to your doctor about just to make sure that it's safe with your regimen.
And is there any data on histamine and insomnia? I know we talked about that a little bit in the SIBO space that comes up sometimes in the IBS space. Is there any role in that or how histamine may impact sleep?
Yeah, that is a good question. So histamine itself is something that helps you stay awake, right? So that's involved in the wakefulness system. So that's why antihistamines make you sleepy, right? So Tylenol PM. But in terms of like histamine overload and things like that, I don't think there's a lot of research. I have to look and see. I don't know enough offhand to speak about that specific research, but histamine is a neurotransmitter that we need, and it is involved in wakefulness.
Perfect. And then some people have asked about, do you have any recommended brands of melatonin, like a safer brand that you typically recommend, or do you mostly do prescription level?
Yeah, great question. So that's a really important question, actually, because there were a couple of studies recently looking at over-the-counter melatonin. And what they found was that a lot of what you get over the counter doesn't actually have what they say they have in it. So what it says on the label might not be what's in the supplement. So I do recommend looking for a third-party tested supplement. So I use Fullscript in my practice for supplements. So look for a third-party tested supplement. I'm just trying to think of some brands offhand. So like Ollie is actually third-party tested. So that's like one you can find at Target or over the counter. For the lower doses that I usually recommend, so 0.3 milligrams, I use Herbatonin Pro. You can get that on Fullscript. There's also some use for the extended release melatonin. So I usually use something like Claire Labs for that one. That comes in 2 milligram extended release. I actually have a melatonin brand guide, so I can send that to you, Erin, if people want to download that.
Wonderful. Well, thank you so much. I really appreciate you giving your time and all of your expertise. I know there was
a lot of questions, a lot of great discussion. So thank you again for being here.
Are you listening to today's episode with the main thought being, what are the steps that I can take to get rid of my symptoms right now? While I hope that the information that we share in every episode of The Gut Show leaves you feeling more empowered and more confident in your body, it's not always going to solve your problem or give you a clear direction for your specific symptoms and your needs. The Master Method membership is an online program for the person with chronic digestive symptoms and IBS who wants step-by-step guidance to understand their body, address the drivers of IBS, reduce symptoms, and build resilience in your gut long-term. This membership includes a step-by-step course and a dietitian-led community that teaches you how to holistically address each symptom and the IBS drivers, how to reduce symptoms more strategically and with confidence, and guidelines for better gut health long-term so that you're not only thinking about today, but you're also improving your outcomes in the future. It is time to ditch the symptoms and get your life back. The membership is your first step. You can learn more and enroll at IBSmastermethod.com and use the code GUTSHOW, GUTSHOW, GUTSHOW for $25 off your enrollment fee.